I think I discovered my love for neurology during medical school training. I was in a rotation where I got to see a surgical procedure called deep brain stimulation, and I still vividly remember the patient who suffered from essential tremor for many, many years. It was an awake procedure, and she immediately could see that she could draw circles again with perfect circle without any shaking, without any tremulousness. At that moment, it was such a life-transforming moment for her, and she cried immediately, and that really touched me, and I knew that this is something that I want to go into. I try to get to know them as a person in the beginning because I know oftentimes when they come to an unfamiliar place and they can be nervous, they can be anxious, and sometimes about their condition they can be quite scared. So I try to just make them feel as comfortable as possible in the beginning, and then just go through their story and really listen to what they have to say, what brought them here. This is actually a very exciting time for movement disorders. There's a lot of clinical trials and newer drugs and also surgical interventions for different movement disorders, especially in the world of Parkinson's disease. It's quite exciting, and especially in Cleveland Clinic, we offer very advanced surgical options.